Welcome to the Mid-Yorkshire NHS Hospital introduction video for the new hydration assessment and fluid balance chart. The hydration assessment has been introduced because, as evidence suggests, healthcare professionals are sometimes unsure of the correct criteria for implementing either a fluid balance or hydration chart. The hydration assessment should be completed by a registrant within 4 hours of a patient being admitted to the unit and once every 24 hours thereafter. Firstly, as per all other trust documentation, ensure patient details are completed correctly in full, including the date. If available, a patient identification label can be used as opposed to handwritten. The hydration assessment requires the registrant to identify the appropriate risk factors that determine whether a patient should have a fluid balance, hydration chart, or no monitoring. From ticking the boxes as seen on the screen, you'll be able to work across the assessment, confirming the next most appropriate assessment chart for the patient. From the example on the screen, patient Joe requires a fluid balance commencing because the following risk factors have been identified. He is receiving intravenous fluid resuscitation, his new score is more than 5, and he's aged over 75. As you can see, although the risk factor aged over 75 identifies Joe to be started on a hydration chart, as per the instructions noted at the top of the chart, if a patient has factors in both the red and the yellow sections, commence a fluid balance only. Therefore, as identified through the completed assessment, Joe requires a fluid balance chart commencing. Please ensure the hydration assessment is signed and dated by the registrant completing the chart. The chart on the screen details the new fluid balance chart used within Mid-Yorkshire. Again, like all other trust documentation, ensure the patient's identification label is completed in full. The fluid balance chart has two main sections, input on the left and output on the right. For the input section, this is further broken down into specific sections which indicate the different ways in which patients may be receiving hydrational input. These include intravenous medications, intravenous fluids, and/or oral drinks. There are a further two more sections which enable the recording of other sources of input, such as nasogastric NG feeding and/or percutaneous endoscopic gastrostomy PEG feeding. The output section is also further broken down into specific sections which indicate the different ways in which a patient may be losing fluid. These include urine output, nasogastric NG aspirate, vomit, and/or stoma. There is also a further section which enables the recording of other sources of output, such as surgical drains and/or chest tubes. The fluid balance requires an hourly total by moving horizontally across the chart and adding the total of the hour to the previous hourly total. Input and output are totaled separately but in exactly the same way. The balance on the far right column is calculated as input total minus the output total for each hour. To calculate 12 hourly subtotals, move down the columns vertically and add the totals, documenting in the subtotal boxes at the bottom. At the 12 hourly midday point, the fluid balance chart should be reviewed by the registered nurse and the medical team caring for the patient. A signature is required from both practitioners. A 12 hourly cumulative balance should also be calculated and recorded. The 12 hourly cumulative balance is the subtotal input running total minus the subtotal output running total. This is the completed fluid balance chart after 24 hours. The second 12-hourly section is to be signed only by the registered nurse caring for the patient. This section also requires a 12-hourly cumulative total, which can be calculated as previously discussed. Once the 12-hourly balance has been calculated for this second section, the whole 24-hour cumulative balance can be calculated. This requires adding together both the 12-hourly cumulative totals, like so. The cumulative balance is noted to the top right of the fluid balance chart. The cumulative balance is the current balance plus or minus the balance from the previous day's fluid balance cumulative total. If it is day 1 of commencing the fluid balance, then the cumulative balance is the same as the 24-hour balance. If it is day 2, the cumulative balance is day 2 24-hour balance plus or minus the 24-hour balance of day 1. If it has been decided that the fluid balance chart for the patient can be discontinued, the bottom section requires confirmation and signature by both the RN and the ward doctor. Thank you for taking the time to watch this video. If you have any further questions regarding the hydration assessment and fluid balance chart, please contact the Quality and Safety team within the Trust.